committee members and staff that the committee meeting will be recorded and broadcast throughout Parliament Bill, not Parliament Bill, it's going to be broadcast online. Just advise everybody in the public gallery, everybody's welcome to use mobile devices as long as they are in airplane mode. All devices should be muted. You can connect to the Wi-Fi, it's just a guest Wi-Fi, there's no password required. So with no apologies, I know we have a number of members coming late from the policing board, but they should be here. Or unless anybody's aware of any apologies? None? Okay. Chair's business, there's none today. So draft minutes, can I refer everybody to the draft minutes of the meeting held on both 27th and 29th of January? They're pages 6 and 9 of the main pack. Everybody content? Okay, thank you. Matters arising? None. So just moving very quickly on then to item number 5, which is a presentation from the Shankill Shared Women's Centre. Can I refer everybody to the papers at tab 18? Welcome Dr. Betty Carlisle, who's the Chief Executive of the Shankill Women's Centre, who's made us very welcome here today. So Betty, I'm going to hand over to yourself just to make some opening remarks, and then I think you're going to show us a video.
Okay, well, just to say, I am absolutely delighted that you are here today, and I think that this is maybe something a bit groundbreaking, and if we could have other committees here, we would love it. It just feels as if you're more into the community and into the heart of the community. I was delighted to be able to take some people around the work we do, as well as a tour of this wonderful building of ours. So what I would like to do would show you a video, and the video is the making of this building. So it starts from this was derelict ground at the very beginning, and us working and how we included the community the whole way along in the design and the building of. But the video says it all, so probably the best thing to do would be turn the video on and have a wee look.
Thank you.
We're in the Shankill Women's Centre today. We're going to be looking at the materials for our new build, which hopefully is going to be up in a couple of years' time up in Lanark Way in the Shankill. We're going to be looking at materials like brick and the window frames and the outside area. And we're also going to be looking at branding, the way we brand the new centre and the new logo.
Today we've got together with our architect from Todd's Architect and with the 2 ladies from the branding company. Today we were looking at colour schemes, designs, different sort of logos and things up for debate, because obviously we were very interested in keeping our history and our nod to the hummingbird, because we've had a hummingbird building before, we've had a hummingbird logo. And it's very important to us that the hummingbird represents the women that we support, because the hummingbird is told it can't fly, and we tell women you can fly, and we're going to help you to fly.
So we've been working with the Shankill Women's Centre since 2015, and in the last year we're trying to bring their scheme to life. And a part of that process is showing the women what they're getting in the centre itself, but also showing them how the building will look when it's done.
The board are meeting tonight for to look at the final plans for the new build, which has been ongoing from 2015. And the reason for the new build is for shared space. We don't have the room to expand anymore. We don't have the room for the classes or the childcare. We'd have to break out into 2 different buildings for our childcare. So we need this building so badly. That's why it's on board at the minute, and that's why we need it, because we don't have the space.
We're looking to have more activities, so once there's that space that we can use, we're hoping to utilise it and put more programmes on for the women and create them relationships, deepen them even further and get more people involved.
The plans look absolutely fabulous. It's a brilliant building. We've looked at all the different types of structures that are going into it, the materials that get into it, and it's all very modern.
Shankill Women's Centre is a gem in Belfast.
It's so well known. It's so well known by all cultures and communities, and it provides such fabulous services, particularly in the areas of training, family support, health and well-being, and protecting the most vulnerable. So to see Shankill Women's Centre finally having this home of their own, right beside an interface, so it's going to change the outlook in relation to that. It's part of the community, but it's also part of wider Belfast. So to see them having their purpose-built facilities all under one roof, a one-stop shop for services for women, families, and it doesn't matter where you come from, what community background or what culture, Shankill Women's Centre is going to be a great central place to come for all your support needs.
This building has been 10 years in the making before it's got to this. We can see it now, it's coming together, and in 3 or 4 months' time there's going to be cladding, there's going to be brick, and it's going to look more like a building rather than just brick and mortar on the ground and muck on the ground.
I think obviously Protestants, Catholics majority will be the main users of the centre, but I do think there will be other ethnicities, other races and stuff. Obviously it's clear in some religions some women don't get as much support as our country does, so it would just be probably nice for the centre to offer some support to those women who aren't getting support from maybe their own background.
I think when we talk about that, when we talk about good relations work, I mean, communities have been well ahead of the game. I mean, they've been doing this for many, many years. I mean, Betty and the women here at the Shankill Women's Centre have been working with different community organisations from across Belfast. And I think that giving assets like this over, really investing in that kind of work shows that we take those kind of initiatives seriously. I think that's what it's all about. It is about empowering local women. It is about empowering local community development. And I think with the different aspects of the work that we'll see taking shape within the new Shankill Women's Centre here, it will be truly transformational. We're giving them a state-of-the-art building like this to allow them to be able to work and to continue to help this local community grow. I think that's what it's all about. It is the positive work that goes on in the city of Belfast right across different communities, and it is about bringing people together and allowing them to have that space to continue to create the city of Belfast that we all want to be proud of.
It has been a wee bit of a labour of love. So this project started way back in 2006 when we first took the plans on for the Shankill women themselves. And then obviously when the peace funding came in and it developed in the Shankill Shared Women's Centre, there was a lot of involvement and changes that we had to make to the plans. And I think one of the big things that we wanted to make sure was that the building's set within its context. So the way the building is laid out is that we have the reception as you come in with an exhibition space, so you get the first impressions of what the centre does. On the left hand side we've got the cafe where you can get a cup of tea or coffee, or you can actually have a full meal, and that extends into a large multifunctional hall which can be used for large events. And then on the other side of the ground floor we have the nursery, which does education from toddlers right up to after schools as well. Moving up through the building up to the first floor, it's really split into the administration hub for the Shankill women to actually carry out their work. And then there's the adult education to the right hand side. So that has your art therapy rooms, your home economic rooms, your IT facilities and your training suites. So it does all sort of the skills that you need for your GCSE level and beyond. And then up at the very top of the tower we've got the youth empowerment facility, which is a large multifunctional hall that can be used for events, can be used for exercise. And the main thing that we've done is made sure that all the spaces are as flexible as possible, and that even the corridors work as hard as possible for chance meetings and interactions as well.
A lot of these women are coming in because they haven't been leaving the house. I mean, there's some women who wouldn't come into a room, and where now they'll walk into a room completely filled with strangers and just be able to speak and have conversations.
I had lost my daughter to an addiction. I'm not on my own out there that lost a child. There's a lot of parents out there, and we need to get that out to them and to say, come along here, go along till the new centre is bigger. You know, it's going to grow bigger, and there's a lot there for us.
I really can't wait till the new centre's opened and get involved more and helping out more. I think it'll be great, and if other people come on board, it'll help them too.
We are investing in the future. You know, Belfast is a fairly young city, and I think through these kind of projects where we're really, you know, empowering the local communities to actually look towards the future, you know, to take sense of what the needs are, what is the needs within the local area, and it's through an asset like this that you're able then to start trying to address those needs, whether it's through tackling issues like isolation and loneliness, also giving people the space to be able to come in and actually plot out their own future, plot out their own pathway of where they want to go, and that's what this new centre is going to be able to do for this local area.
The making of this building from the very beginning has been an enormous journey, absolutely fascinating. I have actually learnt a lot, and the staff in the centre has learnt a lot as well, but for them helping me out, getting on with their jobs while I was stuck in a room looking at maps and things like that. It's been fascinating, and it's just going to be like a phoenix rising out of a derelict site.
So just speaking to that, that's a wonderful thing that we have, that we love to show people. It was really hard work, and it's even amazing sometimes when I take people like yourselves around and I'm going, my goodness, this has really happened, you know. But just quickly, another thing I'd like to tell you is we got this money from Europe, peace monies, through SEUPB, and at the beginning of last year, SEUPB sent me up a form to fill in, saying that they think would be good candidates. We put it in, thinking nothing more of it, and July last year I got an email saying, you're a finalist. I kind of went, finalist with what? So anyway, what happened was, there's a big thing in Europe called Regio Stars, and 266 countries across Europe had put in for this Regio Stars, and we were finalists. There was 25 finalists, and we were one of them. And it was broken into 5 categories, so we were in one of the categories against 4 other countries. So in October, Leslie Ann, who you met earlier, Leslie Ann and myself went over to Brussels and we did a presentation. And they told us we had to do a presentation in the style of Pica Chucha, which I'd never heard of. But anyway, we got a training course and I looked it up, and the Pica Chucha style, Pica Chucha means chit-chat in Japanese, and the style is that you have 20 seconds per slide. You have 20 slides and you speak 20 seconds per slide. And I thought, how am I going to do this? Do you know of it?
No, but we're going to have
a lot of our presenters should know it.
I've said this, I think it should be implemented into government. And what I discovered through doing it, you have to tell the Pica Chucha presentation in the style of a story. So we did that, and that was okay. And what I learned practicing was 20 seconds is no good. It's actually literally about 15 that you can speak for, because you have to breathe and you have to swallow. You know? So anyway, we went over, did it, and we won. So the following night after the presentation, we had to go to a big place like the SSS or SSA Arena and receive our presentation. And we have a very small clip of a few minutes. And I just want to explain that all the way through it, we were the last category, or the one before the penultimate one, I think. But anyway, whenever people were getting up and the whole room was clapping really nicely, and when we won ours, was screaming. And that was from about 6 ladies at the back of the room who works in the Brussels Commission, and Gina McIntyre, who flew over for the presentation. So I'd really like us to see that.
Category 5.
A Europe closer to the citizens.
This category emphasizes projects aimed at fostering sustainable and integrated development across various territories and local initiatives. Let's check out our finalists. I would like to invite back on stage Director General Themis Christofidou, together with the juror, Professor Helena Leino from the Tampere University.
And the winners are Shankill Shared Women's Centre.
What an enthusiasm! It's time to share the jury's insights.
Yes, as in category 4, also in the category 5, the jury had to say, we need to say that it was a very difficult choice. As all the 5 finalists, those projects, they were excellent and they truly reflected the EU principles and the category 5 objectives, a Europe closer to citizens. In the end, we as the jury selected Shankill Shared Women's Centre in Belfast as the winner. This centre is the first of its kind in Northern Ireland, a dedicated shared space for women and their families from Protestant and Catholic communities across the region to meet and work together, also providing a wide variety of services such as childcare. This project truly illustrates the power of citizen initiatives. It shows that it is possible to bridge religious and cultural divides, even violent and long-standing ones. Something that we can wish for all of Europe and the world in such challenging times as these. So congratulations, Shankill Shared Women's Centre.
Now, ladies, Europe is watching you. Europe is watching very closely Belfast. So what message of feeling would you like to share with everyone who believes in building a better future?
I'm very overwhelmed by this. I didn't think this was going to happen. I think determination. We had a lot of obstacles along the way trying to do this, and I wasn't letting go. My staff team around me, all our partners weren't letting go of this. We were going to overcome those obstacles, especially the violence. We brought women together, and I just believe in the power of women and what they can do.
That's a beautiful message. Thank you very much. And please take back your seats and enjoy the rest of your evening.
Darius. So we're really, really proud and pleased to have that. It was a wonderful day. And as I said, I really wasn't expecting to win, so I was standing there with a big lump in my throat. And I don't cry. I think it's years now I cried. And I thought, she points this mic at me, I'm going to cry. But I didn't. So it was wonderful. So thank you all again for being here. I'm really delighted, and please, as many times as you want to have committees and pass it on to other committees to come here. Would love to have you.
Okay, so we will pass that on to the rest of the Assembly in terms of the invitation. So we thank you very much, you and your team, for the very warm welcome that we have received today, and opening up your facilities for us to have the committee. We're equally as proud of your achievements. I think it's certainly well worthwhile, well deserved in terms of the recognition that you have received from Europe, but also from the local community and further afield across the north in terms of the work that you do. This is my first visit here, but I had an understanding and sense of the good work that went on in the Shankill Shared Women's Centre. So, I mean, I was very lucky. Some of us were in a bit early, got a tour of the facilities. We've seen them in the video. So the work that you do here is fantastic. It is an excellent, modern facility which allows you to do the work. I think the work is the important aspect of. So, I mean, social activities, promoting life skills, shared education among women, health and well-being. Dealing with social isolation, and obviously the childcare facilities, and much more. So the work that you do is fantastic, and it's always nice to have nice modern facilities. So the best of luck to you and your team for the building and for the service that you provide, and the good work that you provide for the women of Belfast and beyond into the future. So thank you very much.
Okay, thank you.
Okay, Diane?
No, just again to re-echo those words and to say it's a fabulous facility. It was, I suppose, maybe what the video and all doesn't show. It was hard fought and hard won. I've known Betty for years, and when you're summoned to a meeting by Betty, you always know that there's something at the other end of it. So one day, we were all gathered in Le Mans. She provided us with lunch, and then she said, "Now listen, girls, we need a new premises, and we need to find out how to do it." So it is fantastic. It is an amazing building, but it's also amazing for the amount of work that goes on in the building and the outreach to the community. And I suppose, as Betty said, it was done by the community and local women in the community, and I think that is probably unusual, achieving so much, but also amazing. So thank you.
Thank you, Diane.
Okay, Betty, thank you very much. Thank
Okay, thank you.
I'll take my trophy with me.
Look after it well.
Don't forget it.
Okay, members, moving on to item number 6 on our agenda. So oral briefing from the Permanent Secretary on community care and patient flow in our hospital. So can I welcome forward Mr. Mike Farr, Permanent Secretary within the Department, Ms. Tracy McCaig, Interim Chief Operating Officer within SPPG, and Mr. Peter Toogood, Deputy Secretary within the Social Services Policy Group. So you're all very, very welcome. You have sent us a briefing paper. I'm going to hand over to yourselves just for introductory remarks. Any further information you want to give us, and then we'll go straight to questions.
Yeah, thank you, Chair. So first of all, what a great way to start the afternoon. That was really inspirational. So and very much the kind of ethos that we're trying to build into this idea of neighbourhood health. Really, really special. So it's great to be here. And also, as always, I welcome the opportunity to be here for yourselves and account for the way in which we're trying to manage some of the health issues that we face in Northern Ireland. So very much welcome the opportunity this afternoon to talk to you. I think the area that you're particularly interested in this afternoon is a hugely important area. When you look at community care and flow of patients through our system, it's a sentinel kind of indicator as to whether or not the system works, in the sense of how do people progress through our system when they need it. And so I think there's some really important pointers in what we're learning, what we understand, and how that will inform what we need to do next. But I want to start by saying I think none of us believes the way the system's currently working is the way that it needs to. and we know that people are not getting the level of experience, although they often when you do get to our services, you do get high quality care. We have some brilliant staff who are incredibly good at what they do. But just in terms of the way that the system's working at the moment, people aren't, and I'd like to assure anybody who is listening to this or watching this who reads the transcript that we are working incredibly hard to get people's experience of urgent care and the management of their problems through our hospital system back into community, etc., to a level and a standard that we would all want to experience ourselves for our families. So I'd like to assure people we're working incredibly hard in this area. The next thing, really just to say, which I'm sure we'll get into this afternoon, is that health and social care is quite a complex system. So you think from, people managing their own problems through to accessing care in community, the process of referral and or conveyancing, their appearance at ED, the way that ED manages those patients through to admission. And then, of course, you have discharge, rehab, and sadly for some people, palliative care. These are a complex set of operations which ultimately need to sort of correlate. And we know that community services and looking at the flow needs fixing, but the way to fix that is to see the system overall and not just think that actually if you apply capacity into one bit of the system, that solves it. Because ultimately you need this balance of the way the system operates to make sure that that is a sort of smooth transition through people's care. And we can sometimes be fooled, and I'm not saying that anybody around these tables are, that if you invest more in one bit of the system, that solves your problem. Very often it can cause impact later on unless you've had that balance of investment. So I think your attention to this idea of flow is really important and really critical. And, I'd want to encourage you to think about how this fits in with the wider issues of who ends up needing our services in the first place in terms of what we're trying to do to improve prevention, what we're trying to do to manage people so that they don't need to be flowed through a hospital system because we can manage their care in the community setting anyway. And just to give you one illustration of that, we are working hard on Programme for Government, as you know, to deliver elective work. If we invest in more diagnostic capacity so we can get to people sooner, more diagnostic capacity by definition will increase the number of people who require treatment. The more people who require treatment, that will put pressure on admissions to our beds. The more people are going through our beds, puts pressure on our ability to discharge them and pressure on what we need to sustain them in their own home. So by actively trying to get more people through diagnostic processes, you have to think about its commensurate impact on other areas. And so in discussing, as we will this afternoon, some of these issues specifically around the community care agenda, and I do think this is an agenda, an area of care where we need to do better in terms of its relationship with the service, because, as you know, a lot of community and indeed social care services are provided not by the HSC but commissioned by the HSC. And so getting these relationships right and managing that flow is hugely important, and we need to do that. And of course, the solution ultimately is getting the right people into the right place in the system so that you can understand what's needed and manage that process of flow. And we often describe this, I'm sure you're going to talk about this afternoon, and we're happy to answer it on this idea of this is a kind of winter thing. Actually, it's not a winter thing. It's about the way in which you have a baseline of care that we need and think is our routine, and is adequate to manage the problems that we're facing. But you need to be able to surge your capacity up and down, which includes beds, workforce, and the process of admission and discharge in order to get this balance right. And if we were at, as I always say, that world-leading edge, what we would have is a really agile system that can flex up and down depending on demand so that no one effectively gets impacted in a bit of our system because we have additional demand because of a respiratory or a communicable disease problem. And so it's a really important discussion today, and I really welcome it. And I just want to say I have Tracy with me, as you know, who is our kind of de facto chief operating officer for the way the HSC works, can get into any detail about that bit of it. And I have Peter Toogood, who is my lead official for responsibility for social care. And again, we can get into any of those areas, and I will ask them if you've got questions of detail to lead on some of the answers on that. But again, just to say it's an important area, and we're really happy to be here to answer questions.
Okay, thank you, thank you very much for that. So, going to go straight into it. The hospital flow is a major issue. So every day the press, including today, are articulating horrific stories about patients' experiences in EDs. They could do that every day of the week, probably from every one of our hospitals. And we've had conversations with yourselves on this before, and we've had conversations on the winter plan. Certainly prior to Christmas, we were hearing from the Minister and others about capacity issues within the home care sector and the reason for delayed discharges. But then we also started to hear, certainly I started to hear from the home care sector that some of the things that they were hearing and we were hearing was at odds with what their experiences was, and that they have lots of capacity, and some of them were saying we could take many more patients if they were discharged from the hospital. And I understand exactly what you're saying about the complications, and it's not just as simple as that. There are many factors surrounding that. But I think I would like to use today as an opportunity just to explore those factors, and more importantly, what the department is doing about it. Because this problem is not a new problem. It's something that our health system has been experiencing, and we should have had long-term plans in place. So I wouldn't like to think that we're here in a couple of years' time hearing the same types of arguments. So I want to just explore the detail of the capacity issue that we're hearing that is available within home care sectors, and why that isn't being utilised, and what are the kind of immediate plans, notwithstanding the resource issues within the department, what are the kind of immediate plans that we're doing to overcome some of these problems?
Okay, well let me pick up on the first point, and then I know Peter will comment on a lot of the work that we're doing with the sector to try and get into a different place. I mean, the truth is that we have not had, in my experience, a strategic relationship with the sector. It's quite varied, as you know. So when we talk about the home care sector, there are people who can take high levels of acuity, they can take dementia, but others can't. And there are some, sort of geographic limitations in how capacity meets the demand in a particular area. We might have capacity in one bit of the Northern Ireland, but not necessarily meets it. So I think we've got to be quite careful about saying the home care sector as though is a completely homogenous group of services. That they're not. The truth is that what we need to do is have a much more strategic, ongoing relationship with this sector, which looks at capacity that's required, the profile of beds that are needed, the relationship between domiciliary support and residential support, which again is another factor in terms of what's needed for individual patients. And if all we do is spot purchase every now and again when we need that level of service, it's going to be hard to match capacity and demand. And so the work that we've been doing, and I'm going to ask Peter to comment on that because there's quite a lot of work in train, is really to get that kind of strategic relationship. And it is disappointing, I think, that perhaps I would say we've increased capacity generally. If you look at our workforce numbers in health over the last 5 years, significant numbers of additional staff have been put in the system. It's levelled off a little bit, but we've seen 15% increases in things like our medical workforce, our nursing, midwifery workforce. So there's been a lot of capacity increase, and yet we're still facing this problem.
Have we a workforce? Sorry to interrupt you, but in terms of workforce, is there a workforce issue within domiciliary care?
Well, I'll let Peter talk about the way in which we're trying to get into that, but you have to have I'll come back to this point about commensurate increase, because the sector that lives on commercial income, which is what it does, mainly 90% of it is in that sector that has to generate a profit. The balance of workforce and whose responsibility that is really falls to a strong relationship about what we need from that sector, as opposed to just, as I say, being in a spot purchasing arrangement whereby people can't increase or reduce staffing on an ad hoc basis. They need to have some level of certainty and understanding of what our need is. And the last point before I ask Peter to talk about the process of engaging with the sector is that the data that we're now getting because of having Encompass and GP data really should allow us to be very, very good at this. But in the past, we've not been as good as we would want to be, and that's why the work that Peter's been leading as a collaborative with the sector, I think is really important to understand. So, Peter.
Thanks, Mike. I think hopefully the committee's aware, it's been mentioned probably a number of times through either written or oral briefings, the forum that we set up in 2023, which was the Social Care Collaborative Forum, and that was really much, and that's a forum that I chair, and that was very much aimed at saying, I suppose based on the principle that such are the complexity, the breadth and the complexity of the issues in adult social care, not one single sector can address those, which is why we have strategy colleagues around the table, independent sector colleagues, and that's or voluntary community sector officials, representatives, are so it really is that collaborative effort. It's been a process. We've had to build relationships, and we've had to get comfortable with working with each other because that wasn't necessarily always the case. The relationships prior to that were quite adversarial, and when we need to reform, so we had the reform of adult social care consultation. We know we need to reform. Knew that we needed issues facing presenting issues. We would work on we want to pick out some we want to address collectively. Set out some of that work today. So things like early review.